Hi, this is Chengzi. In my last two videos, I discussed the symptoms and diagnosis of Alzheimer's disease. In this video, I will focus on its treatment. When it comes to treatment, there are more factors to consider than with diagnosis. Patients or their family members may wonder, are there specific drugs available? How are these drugs administered and what are their efficacies? Do they have side effects? If the medicines are effective, can I afford them financially? Are they covered by my insurance? If I do not live in the US, can I still access these medicines? Let's start with the first question. Are there specific medicines available to treat Alzheimer's disease? The answer is a cautious yes. As of August 2024, a total of 9 drugs have been approved by the FDA to treat Alzheimer's disease. These medications fall into 2 categories. 1. Drugs that target the cause of Alzheimer's disease and slow down its progression, and 2. Drugs that may temporarily alleviate some symptoms of Alzheimer's dementia. So what causes Alzheimer's disease? I don't want you to fall asleep while I explain the pathological mechanisms. I'll use an analogy. Alzheimer's disease is often described as a disease of the brain. You can imagine the human brain as a sophisticated small society. Each brain cell is like a little human, and these little humans communicate with each other using chemicals, controlling everything from your thoughts to your movements. In a healthy brain, messages are passed quickly and efficiently. But in Alzheimer's disease, something goes wrong. Amyloid beta proteins accumulate and form plaques between brain cells, like trash piling up on the road, making message transmission difficult. Meanwhile, inside the brain cells, tau proteins, which normally stabilize and maintain the cell's shape and structure, become hyperphosphorylated and tangle. As the brain cell loses its shape and stability, message transmission becomes even less efficient. These plaques and tangles are what many scientists believe cause the symptoms of Alzheimer's disease, like memory loss and confusion. However, it is important to know that this idea, known as the amyloid cascade hypothesis and tau hyperphosphorylation, was proposed many decades ago. Since then, much research has supported this theory, but new evidence is beginning to challenge it. Until new theories prevail against the existing mainstream hypothesis, medicines targeting the cause of Alzheimer's disease still focus on preventing the formation of and efficiently removing amyloid beta plaques in the brain. Many of the developed medicines also have some effect on reducing the entanglement of tau proteins. 3 FDA-approved drugs fall into the targeting cause category: aducanumab, Aduhelm, donanemab, Kisunla, and lecanemab, Leqembi. They can slow the decline in memory, thinking, and function in people living with Alzheimer's disease. Now let's talk about the symptom mitigating drugs. 6 FDA-approved drugs fall into this category. I'll take 2 to 3 minutes to explain how these drugs work. Please kindly hold back your yawn. I'll do my best to keep things simple. In the brain cells use a chemical called acetylcholine to communicate and carry out cognitive functions like memory, thinking, judgment, and language. Acetylcholine is typically recycled quickly by cholinesterase, think of it as a magic trash can, and reused by brain cells to maintain a steady supply of this chemical. In the brains of Alzheimer's patients, due to abnormal B-amyloid accumulation and p-tau entanglement, the efficiency of acetylcholine usage becomes very low, but the recycling process continues as usual. It's as if the downstream brain cell struggles to understand the message before it's recycled by the trash can. So what can we do to keep communication going? Enter the cholinesterase inhibitor, like putting a lid on the trash can. It slows down the recycling process, allowing more messages to be received by the downstream brain cell before they're discarded. In addition to acetylcholine, there's another chemical messenger in the brain, glutamate. If acetylcholine is like messages written on notes passed between brain cells to handle fine details like memory and attention, then glutamate, the excitatory neurotransmitter, acts like a loudspeaker. In the brain cells of Alzheimer's patients, glutamate levels are often abnormally elevated, causing the cells to become overly active, unable to function properly, and even leading to their death. Therefore, it is necessary to have a volume control to reduce the overexcitement of brain cells. Based on their mechanisms of action, these symptom-mitigating drugs are divided into several subcategories. 1. Cholinesterase inhibitors, the trash can lid, including donepezil, Aricept, galantamine, razidine, and rivastigmine, Exelon. These drugs support communication between nerve cells and are prescribed to treat symptoms related to memory, thinking, language, judgment, and other cognitive processes. 2. Glutamate regulators, the loudspeaker volume controller, include memantine Namenda. This drug regulates glutamate and helps the brain process information. It is prescribed to improve memory, attention, reasoning, language, and the ability to perform simple tasks. 3. Cholinesterase inhibitor plus glutamate regulator. The trash can lid plus the volume controller. This drug combines cholinesterase inhibitor donepezil and glutamate regulator memantine and has a new brand name, Namzaric. It is approved for moderate to severe Alzheimer's disease. 4. Other drugs, suvorexant, Belsomra, and brexpiprazole, Rexulti, can be used to treat behavioral and psychological symptoms, but are not specifically developed for Alzheimer's disease. With so many drugs available to treat Alzheimer's, how effective are they? If we were to provide a simplified summary of these drugs, we would say, the targeting cause category is more revolutionary, but doesn't work very well at present. The symptom mitigating category works better, though the effects are temporary. The symptom mitigating drugs are what Alice used in the novel Still Alice. No targeting cause drugs were available at that time. Over the past 17 years, more effective symptom mitigating drugs have been developed, but it remains difficult to slow the progression of the disease, let alone reverse it. Let's take a quick look at the efficacy of the targeting cause drugs. Aducanumab, Aduhelm. It has been shown to reduce amyloid beta plaques in the brains of Alzheimer's disease, AD patients, as observed through MRI or PET images, but its clinical efficacy is still being debated. It may slow cognitive decline by 22%. Donanemab, Kisunlatium. It can reduce clinical decline, including memory, thinking, and daily functioning by 35% and slow cognitive decline by about 22%. Lecanemab, Leqembi. It can slow clinical decline by 27%. I'll use several tables to summarize all FDA-approved Alzheimer's drugs, including their approval date, usage circumstances, administration method, common side effects, and the countries where they are accessible. You might get the impression from the previous table that the benefits of these cause-targeting drugs are so moderate, the side effects so strong, and that patients must receive IV infusions every 2 to 4 weeks. What's the point of using these drugs? Well, for many patients, especially those with early-stage Alzheimer's, even a small delay in the worsening of symptoms can significantly improve their quality of life for a considerable period. For the possibility of slowing the disease's progression, many patients and their families are willing to accept the risks of side effects. Additionally, there are no specific drugs to cure Alzheimer's disease, a situation that has persisted for more than 90 years, leaving patients with very limited alternative options. Now let's look at the category 2, symptom mitigating drugs. Most symptom mitigating drugs have been approved for many years and are widely used in the US and even globally. These drugs are easy to take, usually by mouth with meals or before bed. They are used to treat mild to moderate and even severe dementia. The side effects are typically mild, such as nausea, vomiting, and loss of appetite. Here are 2 more symptom-mitigating drugs that are not specifically developed for Alzheimer's disease, but can be used to improve mental or behavior-related symptoms of the Alzheimer's patients. Brexpiprazole is used to treat the symptoms of schizophrenia and depression. In Alzheimer's disease, brexpiprazole is used to treat agitation in people with dementia. Suvorexant is indicated for the treatment of insomnia, difficulty with sleep. It was approved by the FDA in February 2020 and became the first medication to treat sleep disorders in Alzheimer's disease. As we know, symptom-mitigating drugs can only offer short-term benefits and cannot stop the underlying disease. So why do patients still need to take these drugs? It's hard for healthy people to imagine the difficulties an Alzheimer's patient encounters in their daily life. Even the smallest tasks can become overwhelming. For instance, when a patient doesn't take their medication, they might frequently struggle to find the bathroom and end up urinating on themselves. After using the toilet, they may not be able to zip up their pants or fasten their buttons. Similarly, without medication, patients might get lost when they go outside, leading them to avoid leaving the house and shrinking their social circle, which can cause their mental state to deteriorate. In these situations, although medication only provides temporary relief, this brief period is still precious to the patients. At least they don't have to rely on others constantly, allowing them to maintain some sense of dignity. They are less likely to become easily angry or fall into depression, which can leave caregivers or family members feeling helpless. Medication can provide them with short moments of clarity, where they can recognize family and friends, enjoy their care, and reminisce about past happy times. For an optimistic patient, taking symptom-mitigating drugs also buys time for future treatments. Now it is time to discuss the cost. Cause-targeting drugs are certainly not inexpensive. Symptom-mitigating drugs are much less expensive, and most of them are fully or partially covered by insurance. The drugs a patient will use largely depend on their symptoms, insurance coverage, and how much they are willing to pay. However, there is another option. Approximately 140 to 150 clinical trials are currently underway globally for Alzheimer's disease treatments. If patients are interested in becoming volunteers, they can participate in research studies testing new treatments or drugs for their condition. For Alzheimer's patients, something beyond drug treatments is always very important, perhaps even more important. Like many other diseases, including cancer, diabetes, obesity, and hyperlipidemia, maintaining a healthy and active lifestyle can slow the progression of the disease and enhance overall quality of life and engagement. So what are the non-drug treatments? It might be too formal to call them treatments. Instead, it's about living actively, engaging in physical activities like jogging, dancing, or playing sports to maintain good circulation and reduce brain degeneration. Playing mind games or performing memory exercises to prevent memory loss. Listening to music and engaging in art to maintain a positive mood and reduce depression and apathy. And keeping social interactions with family and friends to gain mental support and reduce aggression and agitation. Amidst everything, perhaps the most vital elements are the understanding, love, and emotional support from family and friends. If I had to recommend a movie that best illustrates non-drug treatments for Alzheimer's disease, it would be Still Mine. You'll see that even someone like Irene, in the late stages of Alzheimer's, can still experience joy and peace. The secret is love, because even when Alzheimer's takes hold, they are still ours. Still mine.